we started treating your right hand on Wednesday, and that was because of severe pain. Can you point out the areas that it was hurting you?
It was basically this whole area in here,
Okay,
and also my wrist.
and wrist.
I couldn't put any pressure on my wrist. Lean on something. I
Yeah.
couldn't do that.
Couldn't do that.
I
And it was very painful, and you had had it for how long, roughly?
Oh wow. Probably want to say a year or more.
Okay. And they tried to treat you with medications and.
Not too much. I had
Yeah.
a couple of cortisone shots and
Yeah.
things like that, but they didn't do any good.
Okay.
And I checked with a couple of orthopedic surgeons about having a new joint and
Put in your
installed, put
thumb
in.
area. Yeah.
And I pretty much decided I was going to do that until this other thing, my PSA jumped and I came in and started getting treatments here for that.
Right.
And then I found out about your treatments. So it's worked out really well.
So we treated you on Wednesday, and
Right.
and after the first treatment, did you notice a difference in your hand?
Yes, absolutely.
Okay.
One of the biggest differences is I can pinch things now without it causing a great deal of pain. One of the things that I sounds like silly, but you're familiar with the 1 gallon cartons of milk.
Mm-hmm.
They're about that big.
Right.
Well, up until a week ago, I could not get that carton out of the refrigerator with one hand. I had to pull it out and support it with the other hand, and then when I pour the milk, I'd have to support it because I couldn't hold it tight enough. And now, for the first time, pulled it out with the same hand, poured the milk, no problems at all, no pain. It was terrific. So it's working really well.
So I want to look at both hands here. Can you put both hands out there? So we started treatment to both hands. We've given 4 fractions to each hand. He's at 1,000 centigrade. Can you close your hands now? Oh, good. And so before, you had one finger that stuck, and you had also, what else did you have?
The trigger finger, and then the left hand was just so numb most of the time.
Numb most of the time.
Yeah,
And
like
how
I
about
said,
how about the right hand too? That just had the trigger finger. Was it
I
also
had
numb?
the trigger finger, and it was hard to close.
Hard to close.
And then every time I did close, this thing would still be stuck in there.
Right. So right now the sticking is
Just
vastly
almost.
improved, and the numbness on the hand gone.
But the biggest thing is that I had a finger brace at night when I went to sleep, when I
Yeah.
went to bed. Because otherwise I'd wake up screaming. The pain was excruciating every time it locked.
Right.
But now it's not locking, and
Not
it's
locking.
so nice.
All right. So could you try to bend your hand, turn it sideways for me? Okay, and then close it. Kind of close it. That's the best you could do today? Is that correct?
Yeah.
Okay.
Yeah,
And the level of pain, turn it again for me. The level of pain is approximately a 9-10.
yeah.
Okay. All right. She came to us about a week and a half ago. And can you describe your right hand and your left hand, how they were?
Oh, yeah, very stiff, very, I really couldn't close them.
And the pain
Right,
level on the
and,
right hand?
Yeah, the pain was right up there with a 9-10.
And the pain on the left hand?
And the left hand, occasionally, it would vary.
Okay.
Maybe worse at other times than others.
But on average, maybe 6, 7?
But on an average, I would say probably around 7.
Okay, 7, okay. And that first day of treatment, you had to your right hand, the pain level went from a 10 to
Yes, I was able to move it.
move it?
The-
So
the
your
mobility
mobility
was-
came back to almost like a
Yeah.
normal hand in a way, but not
Yeah,
quite.
in
But
in
you
a
know,
sense, with
yeah.
I could still feel pain, but the mobility is where I noticed it the most.
got it. And so now you've had a total of 6 treatments, okay,
Right.
for 1,500 centigrade to each hand. And now, how would you describe the pain in both hands? Just put up both hands for me, if you could.
I really can't say I have pain.
In either hand now.
In either hand.
And the mobility on both hands?
And the mobility is fantastic.
And you're able to open a jar, which you could.
Yes. I'm able to open a bottle of water with a little bit of help, with a cloth or something, but I can open it.
Okay.
And the same way with a jar.
And you're even able to grip a coffee with one hand, like.
Yes, a cup of coffee I can take. Before I would have to have 2 hands and able to steady it or to
Grasp it.
to grasp it. And now I can pick up a cup of coffee with one hand. And
So from a practical standpoint, in terms of your quality of life, how would you say the treatment was for you?
well, so far, I feel great. I think.
And how many years have you been suffering from this pain?
I have been suffering for many years with taking medication, different medications and things, and nothing seemed to alleviate the pain any, and so.
And that first treatment was pretty amazing to you, that you
Yes, yeah, it was, yeah.
Your daughter is a nurse. She
Yes.
didn't really believe that this was going to work.
Well,
she
yeah,
was-
no, she when I told her about it, she looked it up on the internet right away, and so she, had really never heard of it either, and so she was quite amazed at, and I guess on the internet
Did describe some
goes,
patients,
goes into
yeah.
into quite a bit of detail.
So wonderful.
So, yeah, so she was very happy for me.
Yeah.
Yeah, because.
So we've kind of looked at you and said that your mobility on the right hand was about a 4 or 5, and now just put it up again and just
Yeah. I have no
no
problem
problems
with
that. And the other side wasn't quite as bad, but it
No.
doesn't have any problem either, and the
No.
pain's gone on
No.
both sides.
Yeah.
Thank you. We're going to be starting the treatment to her hands. So which hand is the worst hand in your case? Or
This one.
okay, so the left hand's the worst, and can you close it for me as the
No,
best
I
you
can't.
can? You can't close it all. So turn the hand. Turn the hand like this.
Okay.
Okay. Now try to close it for me.
It's as far as it goes.
That's as far as it can go. Okay. And also let's take a look at the other hand.
Okay.
And the other hand, can you close that for me?
Yes.
And that's again the best you can do on that.
Yeah.
Let's turn it sideways like this. Okay, so that's the best you can do on that hand. And let's take a look at this hand. And that's the best you can do on that hand.
Yeah.
She just finished treating to her right hand. And before I treated the right hand, you could not close it all the way, right?
Right.
And it was almost about like where you were there.
Yeah.
And now, see how far you can go. All the way. Turn your hand sideways. Okay. Open it and close it, please. Put your thumb on it too. Good. So you have a good motion of the hand compared to what you had before already. All right. Thank you. He presents today with severe arthritis of his right hand. He has a lot of destructive characteristics seen in his bones on x-ray, and MRI tends to confirm severe arthritis and synovitis. This is his right hand. He's got cystic here and definitely a cyst right here that is easily palpable. And turn his hand over, he's got a cyst sitting right in here. He's got pain in his wrist area mainly. And let's close your fist at this time. Okay, so he's got a little bit of a finger, he's got a little bit of trapped tendons in his finger here, and he's got this bent index finger. It can't straighten out. What else? Your strength in your hand is about 30% compared, or 30 pounds in this hand and 85 pounds in his other hand. You can close your fist, right? Pretty good, okay. And your main source of pain in the right hand is where?
In the outer area here, crossed here in the wrist area.
Right. If you look on the x-rays, you'll see there's destructive changes of his radius and ulna areas. They've got lots of holes in them, and across all his palms of his hands, and all the bones in the hands have destruction that are noted on x-ray and seen on MRI. Okay, so today he's going to start his treatment to the right hand, and we're going to treat an area from about this location here, coming all the way down. Turn the hand over. We're going to make sure his fingernails are not treated here. Make sure that this is not treated, this fingernail here, and this little finger over here will be set out too, and we'll make sure that's not in the field. Okay, and then after I treat him today, we're going to come back, and right now he complains of pain at a level about 5-6, mainly in the wrist region, right?
Correct.
Here in the main area is this way.
Correct.
And if you tried to turn your hand like this, does that hurt?
Yes.
Okay, so that's where you get most of your pain.
Yes.
And that makes sense because of the bone destruction that I see in this location right across
And
here.
if you put your hand here and I rotate, you can feel grinding.
We just completed treatment of his right hand, and as you can see from a side view, this finger is no longer as bent. Before it was almost like that. Okay, you could definitely see the difference between the two. Now it goes almost straight up. He has this fluid in this area, and there's a lot of pain in this area when he turned his wrist. And so Dale, when you turn your wrist now, like this, close your fist and rotate.
No, not as much.
Not as much pain.
Right. Nope.
Nope.
I still feel a little bit in my index, but
Yeah.
It feels almost like it's been released.
Yes, and that typically is what everybody says. Is suddenly the tightness and the constraint on mobility is suddenly released, and the pain and the
Okay.
fingers start coming back. She's being seen for her osteoarthritis of her hands. Okay, so here we go. So this is her left hand, and you can see that the joints are distorted here and here and here and there, and the thumb, not too bad. The other hand, you can see lots of distortion here, here, and over here, and here, there. And so, and what would you say the level of the pain is in the hands?
It goes to about an 8.
An 8. And which hand is the most painful, or are both of them the same?
This one's worse.
Okay. And could you do me a favor? Can you turn it this way? Okay. So close your hand as best you can. That's the best you can do on that hand. And let's turn it sideways and show people sideways. That's the best you can do. And there's the. Okay, and then let's take the other hand here. This is the right hand, and we're going to close that one. That's the best you could do on that one. Okay. she's had 5 treatments on her left hand and 4 treatments on the other hand. And currently, right now, this is how her hands look straight on. Now, if you could, just lift your hands up and turn them sideways. Okay, now close them all the way, all the way. Okay, turn it sideways like that and close again. See if you can touch your fingernails to your hands. Okay, can't. Okay, and open them up again and close them again and bring your thumbs in. Okay, all right. And how would you rate? Let's talk about this hand right here. How would you rate the pain in this hand?
This hand's great. This hand's much better.
What would you say, level of pain?
Like 1.
1, okay, out of 10. This one here,
It's like a 3, 4.
Okay.
This one hurts.
so they're much improved over what you originally
Yes.
had. Okay.
Yes.